Alright, so welcome to the 9A chapter 20 respiratory system. As usual, we start from section 2. Respiratory system, just how you take in oxygen and breathe out carbon dioxide, has to do with the lungs and all the supporting parts that allow us to breathe in and out. We have to understand that some residents will have difficulty breathing. Some of them have asthma, some of them have COPD, bronchitis. All those breathing problems makes it hard for them to breathe and take in enough oxygen. We talked about pulse oximeter the other day, where we can check to see the oxygen level. If you see that your resident is gasping for air, or having difficulty breathing, then you need to check the oxygen level. If it's less than what percentage will you report to the charge nurse? It's a question.
Yeah.
If it is less than what number?
Less than 60.
No. It's at 60.
80.
60, they are dead.
80, yeah.
No.
I think between 80
I'm talking
and
about
100.
pulse, oxygen level. What oxygen level? I'm not talking about pulse. What oxygen level will you, below what number must you report to the charge nurse? It's going to be on your quiz. Okay, what's the normal oxygen level? We did it, remember we stick our we put our finger to the pulse ox machine the other day.
Is it 60 to 100?
No. It must be 75% or higher. 75, remember you were 98%. So if everyone should be 95% or higher to be normal. Anything lower than 95%, they need oxygen. So they're going to have to get artificial oxygen. So if you see that they're having difficulty breathing, report to the charge nurse immediately so that they can get oxygen. Some of the structures and functions of the respiratory system. Trachea is the main passageway that goes from the throat to it's called the windpipe, to the bronchi. Bronchi is a branch of the lungs. Alveoli, also it's like that's where the exchange of oxygen and carbon dioxide takes place. Then the lungs is the main organ of the respiratory system, responsible for oxygen and so on. Inspiration is to breathe in, expiration is to breathe out, respiration is to breathe in and out. So know the difference between the terminology. Inspiration, breathe in, expiration, breathe out, respiration, breathing in and out. The process of inhaling and exhaling. Those are your respiratory system anatomy picture. Usually you find out that where there's a blockage or a narrowing that prevents oxygen from flowing in comfortably, or carbon dioxide from flowing out comfortably, they will name the condition, like after that area, like you don't have laryngitis. It means the larynx is blocked, and that's where the problem is. Or bronchitis, it means that it's down there. So, or like somebody has a tracheostomy. We talked about that in another class. That means they've inserted a hole through the trachea, and that has affected the larynx, which is the voice box, and then the person cannot make a sound because they put a hole here and put the trach through so the person can breathe. One thing to remember is that when people there's that epiglottis. Epiglottis is that thing that is hanging when somebody opens their mouth. You see something hanging in the middle,
Yeah.
and then you see like two holes. One goes to the stomach, and one which is where water and food goes to. The other side is the lungs, where only air is supposed to go there. So when we drink or eat something, the epiglottis will shut off the trachea to prevent anything from going, any water, any particle from going there, so that your food and water will now go to the stomach. So now, as they get older, which we're going to get to that slide, as people get older, the epiglottis does not shut off completely anymore, making them to want to choke easily. So they easily can choke because of that. So we study all these systems to kind of understand how the changes affect the elderly as we get older. The epiglottis shuts off the larynx during swallowing process. And when we say the larynx enable people to speak, that's the voice box. Respiration, the body starts taking in oxygen and breathing out carbon dioxide. Function of the respiratory system serves as an air filter, cleaning the inhaled air. It's better to always inhale through the nose, because the nose has its natural filter to filter the air that you breathe. If you breathe into the mouth a lot, then it's not being filtered the way the nose would have filtered it. That's why, before you know it, you have some dirt in your nose that you have to clean up. When you're picking your nose or using a tissue, you see all that dirt. That's the filter. That's what the nose filtered from the air you're breathing in, which the mouth cannot do so. Supplies oxygen to the body cells, removes carbon dioxide from the cells, produces sound. So those are all. You could be asked in a question, which of the following is a function of the respiratory system? Producing sound is part of it. Normal changes in the elderly that we talk about, the lung strength decreases, alveoli become less elastic.
So at least 90 minutes. And I want to capture the functions of the
Okay, this is in your book, you know.
is
This is not. It's there. If you just follow it slide by slide by slide,
366.
it's in front of you. I can't believe we're almost at the end of the class and you're just realizing that this thing is in your book.
Sir, the day I was looking for it this afternoon, I was looking for the functions. I was looking for it, honestly, this afternoon.
Where were you looking at? Where were you looking for it?
In this book. I was trying to attempt the quiz.
And all of the. So did you go to the section of the quiz? If the quiz says section 5, did you go to section 5 of the chapter?
I went to section 5. But I think
I will have the same heading. Like we're in section 2 now. Explain the structure and function. So section 2 of the homework will also say explain the structure and function of the respiratory system. Then you just stay with that section on. All your answers to your question will be from there.
Yeah.
And it's not much, right? Also, well, we're almost at the end, and if you have any issue with your homework, you can call either of us or text and say, where do I find this in the book or in my homework? But the slide is from your book. The slide is a summary of your book. All right. So we're talking about normal changes. Lung capacity decreases. So when they take in air, they don't take as much because the capacity to hold more oxygen has decreased. So they're always having shortness of breath. Cough reflex becomes less effective. You know, cough reflex, when the epiglottis does not shut off completely, and let's say a drop of water goes there, it will trigger a cough reflex to cough it out to clear it. But with the elderly, the cough reflex have decreased. So that drop of water goes into the wind section, and they start choking because they can't cough it out. Sure.
What, I don't know the name, what shuts it down? You say
I
it's
think what is
okay. You say, is it like a disease or is it normal for the elder? Is it something that is triggered by maybe a sickness?
Why?
Or the epiglottis not shutting properly when they get.
No, it's not. It's normal changes because, again, remember as we said that the lung strength decreases, so everything decreases. Even in the muscle tone, things that should have worked immediately, reflexes that should have happened, that used to happen well in normal time, will slow down and decrease and decrease and decrease as we get older. It's not a disease; it's just normal aging process. And I always talked about this section of every system that it helps us to understand that they're not doing this thing intentionally. We talk about normal changes in the urinary system, normal changes in the musculoskeletal system. Same thing. So cough reflex is less effective. Oxygen in the blood decreases because they're not breathing in to full capacity like they used to. Decrease in lung capacity causes voice to weaken also. COPD, chronic obstructive pulmonary disease, is a group of incurable lung disease that causes difficulty breathing, shortness of breath, bronchitis, irritation or inflammation. Inflammation just means swelling. So once the bronchi swells, it narrows the passage of air, which then now makes it causes difficulty to breathe. Sputum is what you cough out when you cough, the spit. Emphysema, another chronic lung disease that affects the alveoli portion of the lungs. In that case, so when air fills in, it traps and it doesn't come out. So this is affecting breathing, exhaling. Some of the other condition affects inhaling, but you also need to release the carbon dioxide so that you can inhale in fresh oxygen. How does it feel to take a deep breath and to be able to fill your lung capacity with oxygen? So I normally have my clients do this lung exercise. So you're going to take a deep breath, as much breath as you can take in, and then hold it as much as you can and then release it. Alright, you ready? And it's a breathing exercise. It allows you to keep your lungs expanded. The more you do it, the more you keep your lungs expanded. That's why when you go for a walk, you find out that as you're breathing in more and more, faster and faster, your lungs are expanding, and it does the body good because more oxygen is coming in because the lung capacity expanded. With the elderly, the lung capacity decreases instead of expanding. So then the oxygen level is reduced. Alright, so let's go. As we get older, we will not be able to take in that much air anymore because the lung capacity will decrease. How would it feel if you were not able to get enough air? Then, like I said, you will not get enough oxygen, which means you're not going to be able to function well because oxygen is what the body needs for everything else in the body to function well. Points about COPD. Again, I'm not going to bore you with the different type of breathing problem or lung disease, but they all have one thing in common. If this was a nursing class, you will need to know the difference between each one. what triggers it, what's the treatment for it, what's the nursing intervention to keep the resident comfortable. But the most important thing here is that every resident that have a breathing problem, whether it's COPD, emphysema, asthma, whatever, it's one thing that you're looking for is, are they having difficulty breathing? So you can report it to the charge nurse. If they're having difficulty breathing, that means their oxygen level is going to be low. And some of them have inhaler to use. Maybe you need to give them their inhaler to use, especially if you're doing one-on-one. So get your inhaler, let them use it, because it will clear up. If you're in my, okay, now if you have taken my CMT class, there is a nebulizer treatment where we use, but if you're a CMT, you can do this treatment. If you're a CNA, then you have to report to the charge nurse too.
And when is your CMC class?
This weekend. Every weekend. Unless we have.
What time? Every weekend.
Every weekend, unless we have GNA exam.
I will call you welcome.
Or I have a date.
Oh, the date is from the morning.
I know. Some date is the whole day now.
Okay.
There was one weekend my wife said, we don't go anywhere. This weekend, I want the whole weekend, just two of us, let's go somewhere. So this is what I'll continue the story later. So there's breathing treatments, medicine. You squeeze in here like a albuterol solution. You squeeze in here, you close it, you put this like a mask over them, connect it, turn the machine on. It will form a mist for them to breathe in. It will clear their lungs and allow them to breathe better. So we demonstrate that and show you how that is done. But so let me finish my story now. That weekend, as of Thursday or Friday, I didn't think we had anyone for CMT that weekend. So I told her, okay, she wanted to go to Maryland Life Casino in Arundel Mills for the weekend. So I already booked the place. And we were supposed to check in Saturday at
Is it the MG?
No, that one is different. The one close to the airport, the BWI airport. Maryland Life Casino. The casino place, not the MGM one.
Okay.
Arundel Mills Mall. It's a nice place. So we're on our way there, and we had a restaurant in Laurel, so let's eat first. Since check-in was around 2:30, we're gonna spend the night there. So we just got our food, seated to eat. My phone rang. I said, Mr. Raymond, I'm at the door at the school, and there are 7 other people here. They see they're here for CMT. I didn't know I had CMT. I said, Monday, there's a problem. So what problem? I said, I know you're not going to be happy, but there are 7 people standing in front of the office and I need to go and teach CMT.
But you go back now, so that's not the problem. Since you're passing the night.
Yeah. So she started getting mad. And I said, okay, honey, here's the compromise. I'll give you the credit card and you go and shop.
Yeah. Oh my God.
While I teach the class from 12, it was already 12. I told them, okay, I'll be here at 1. But we'll make it short so that we'll be done by 4. So between 1 and 4, drop me off, go shopping, come and pick. And we'll still go back and catch the
phone.
Yeah. Go to the place. That's all the fun. We have the whole night. Yeah, okay. Okay, how much should I spend? Anyway. So, I felt bad that the people came all the way from home. They took off that weekend and they're at the door. and I didn't know we had class. Anyway, so I was saying that you have to know your residents and know who gets inhaler, who gets a breathing treatment, who needs to get oxygen, so that you can report to your charge nurse immediately. All those treatments, signs of COPD, the same signs. All of the breathing problems have the same sign. They're gonna have difficulty. They're gonna have coughing and wheezing. They're gonna have dyspnea, difficulty breathing, shortness of breath, chest pain, tightness. Cyanosis means that they're not getting enough oxygen. They're gonna have weakness, weight loss, fear, anxiety. They're gonna be anxious, worried. When you cannot breathe, it's like you're going to die. Be supportive. Try to calm them down. It's okay. Sometimes it comes as an attack, like an asthma attack, where it's like they're gonna die. They can't get taking any air at all. So just have them sit down, stop with what they were doing, encourage rest, give small amount of water. So reporting with asthma, talk about that, same thing. Bronchiectasis, chest precaution, that's done by the nurse or doctor. Pneumonia, let's talk about this a little bit. It's swelling that takes place in the lung because of bacteria or viral or fungal infection. Is serious. It's one of those kind of infections that people can get in the hospital. You can get in the nursing home too. If too much dirty air comes in the window and you're in bed, you could wake up with pneumonia in the morning. So chemical irritants, especially if it's dusty, it can cause pneumonia. The lungs will swell, but they have to be on medication, like an antibiotic will treat it. TB, which is what we're trying to get TB clearance now because we're going to a nursing home. Tuberculosis is a very serious and deadly lung infection that it can damage the spine, the brain, the kidney. So if somebody have TB, it has to be reported to the Department of Health. Department of Health have to report to the Center for Disease Control in Atlanta. They now have to trace where you came from, how you may have gotten it, and they need to locate all the people you may have come in contact with. If you just arrived, they want to contact everybody on your flight and have them tested. So you've stayed quiet for too long. Aren't you due for a question? Hemoptysis is coughing out blood. Multi-dose resistant. There are a lot of antibiotics that are resistant to the TB. So that's what multi-dose resistant means. TB is highly contagious. Just by being in the same plane with someone who has TB, you can catch it. They don't have to spit, cough, or anything. Just them.
Which one is more deadly? The flu or the is it bird flu and TB?
Flu is not deadly.
The one
You
that
can't-
Ebola. The one is it Ebola? That one I
No,
was finding.
Ebola is not part of this at all. Ebola is something else.
That's special.
Yeah, that one is something. That one affects the whole body. Okay. But I was saying that if somebody have TB, just by them exhaling in the plane, people in the plane can catch it. So, usually if somebody have TB in the nursing home, the person is going to the hospital straight because the nursing homes are not equipped to have the kind of airtight pressure room for the person to stay. It has to be a room where the air does not come out. Because if the air comes out, even if the person is in the room isolated and they're breathing, once that door is open, the air comes out, people can still catch the TB even from outside. So normally they will, but they can only come back to nursing home towards the end of their treatment, once the treatment is almost concluded, and they know at that point it will not affect, it's not contagious anymore. Oxygen therapy, we talk about that. There is oxygen by mask or oxygen by nasal cannula. This is nasal cannula where they put this in their nose. I'm sure you've seen people with oxygen, they have this on.
Yeah.
Okay. You can adjust it, and the other end goes into the oxygen tank. And the oxygen tank is set according to the doctor's order. Normally like 2 liters. But be keeping an eye on your resident frequently when they're on oxygen. Some of them will take it off because it's irritating their nose or their ear. They take it off and then they're not getting enough oxygen. Okay. The different ways to connect the oxygen, the nasal cannula is that one. Then you have the one with a face mask. Oxygen concentrator is a bigger, larger container that has the oxygen in there. In the rooms, like in the nursing home where I work, while they're in their room, if they're using oxygen, it's going to be in the bigger container, which is called oxygen concentrator. If they're going about, like they're going on an appointment or they're walking around, then we switch it to a cylinder. They can hang behind their wheelchair and connect it and be getting oxygen. How would it feel to need oxygen delivered through a mask or nasal cannula? It's uncomfortable to them. So we have to keep an eye on them frequently, check the skin, like I said. Sometimes you have to lubricate the area. Sometimes we have to put like cloth tape just to cushion the ear a little bit. Because as the tubing rub against the ear, sometimes it opens up to be a sore, like a pressure ulcer. So check vital signs frequently. Just keep an eye on the equipment, report to the charge nurse, if anything. When someone is on oxygen, there must be a sign on the door that says oxygen is in use, no smoking. Sometimes family members can come and they smoke, the place can catch on fire. Remember, generally, those that have difficulty breathing, they need to be put up a little bit. They need to raise their head a little bit. And let me quiz you. What is the name of the position where you put somebody's head slightly up, like about 45 degrees up? What position? Remember those positions, so they can ask you which of the following is the best position for a resident who has difficulty breathing. Which of the following position is suitable for a resident who has difficulty breathing? It's not prone. Prone is them lying face.
I don't mind.
Lying on their stomach. Fowler. Fowlers or semi-fowlers.
Okay.
Fowlers is when you come all the way up. Semi-fowlers is slightly. Okay. So remember all those. They might ask you at a job interview. Okay. You know they have a name for everything. Instead of just put the head up a little bit. Make the resident comfortable. Raise the head of the bed up. But they have to give it a name. That is difficult to remember. Where they got those names from, who knows? when oxygen has been used or ordered for a resident, be alert to fire. Some residents they smoke and they're also on oxygen. So you have to let them know. You just keep an eye on them. Okay. Collecting specimen. We talked already about urinary specimens. Sometimes, especially if somebody is coughing out blood, or is suspected of having pneumonia, the doctor might order a sputum specimen to be collected. You just ask them to cough into a cup, then let the charge nurse know to bring the specimen cup, label it correctly, and then scoop the cough into the specimen cup to be tested. Okay. Collecting a sputum, just explain that. Resident deep breathing exercises, we just did that. So remember, residents who have had surgery such as hip replacement, abdominal surgery, are instructed to do deep breathing exercises regularly to expand the lungs. So just keep taking a deep breath, hold it. As you're holding it, it's expanding the lungs. You breathe out, breathe in again, hold it. So you keep doing it several times. That's breathing exercises. It helps expand the lungs. There's a device called incentive spirometer. Even though the respiratory therapist and the charge nurses administer it to the resident, but it's a breathing. It's like a breathing test to test and see how well they can breathe. So they blow into it. It has like a marking, and there's like a little ball. So when they blow into it, the ball rises up to a certain level. That it could rise up to 70 to 80 to 90. So the higher it goes, the better the person can breathe, because they're gonna blow it. Take a deep breath and blow into the incentive spirometer, and then the little ball will go up, and so it will tell you that they're breathing okay. But the best way to check their oxygen level is the pulse oximeter. Like I said earlier, always give them extra pillows to put their head up a little bit so their position will be more comfortable. That's the end of the 9A.